We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Hey guys, I want to welcome you guys to the Financial Freedom for Physicians podcast. We've got a great episode this week. Before we begin, please hit the subscribe button as well as the notifications bell, and be sure to like, comment, and share if you like this episode, and we'll get into this week's sponsor and show. This week's episode is sponsored by CityVest. CityVest has quickly become the most popular and best way for doctors to invest in top-performing real estate private equity funds that are usually reserved for institutional investors. This unique access to investing in these institutional funds is available for the first time ever through CityVest's easy and secure online investment platform. CityVest does the hard work of conducting due diligence and vetting the investments. They even get a third-party due diligence report that is posted on their website. As a result of aggregating a several million-dollar investment amount into their access funds, CityVest gains access to investing in the institutional investment and is able to negotiate better investment terms such as a 12% preferred return. You can check them out at cityvest.com or go to the link in the show notes below. Now on to the show. Before we begin today's content, here is a quick disclaimer. The information and material presented here is for informational purposes only and should not be construed as investment advice. The content is not a recommendation to buy or to sell. Some of the content may be for accredited investors only or may be sponsored posts. Every investment carries risks. Results have not been verified, so carefully weigh those risks against your investment goals and objectives and see if acting on the information matches with your investment thesis. Do your due diligence prior to investing, and as always, do not invest more than you can afford to lose. So welcome everybody to this week's podcast episode for the Financial Freedom for Physicians podcast, and I'm your host, Dr. Christopher Liu. And as usual, we talk about 4 types of freedom: financial, emotional, time, and location freedom. And my mission is to empower everyone to achieve financial freedom early. And so I try to bring guests and content and information to help inspire you, empower you, and educate you so that you can be on your journey. So today we have a guest, is Michael Grace, and really what's interesting is he's going to talk about blending technology, business, people, and it's going to be a really fascinating interview. Michael is passionate about the power of technology to transform business and allow them to be more competitive with reduced costs. So without much ado, Michael, welcome.
Thank you. Thank you. Glad to be here. Thanks for your podcast. And I love the premise and what you're trying to do to enable folks to live their best life.
Yeah. I know, we were talking backstage, and what's really interesting is, initially it was for physicians and now it's grown to more of a wider audience. And so I introduced you, but I know you have more to tell. So tell us about all yourself, how you got started, and we can go from there.
Sure. Absolutely. Thank you. So I've kind of grown up in healthcare for the last 25 years or so. I've been either an IT leader on the provider side for really large healthcare systems like Dignity Health or Common Spirit Health, as they're called now. I've been on the consulting side for large firms like Deloitte and smaller firms, to kind of tax accountancy firms like Moss Adams. And I've kind of bounced back and forth rather purposefully with a mission to really understand the provider space and what are the needs, with really the goal of how do we change healthcare? How do we allow providers to spend more time with patients and less on, the administrative burden And then I bounce back over to consulting and I try to change things. And then I bounce back over to the provider space and get more intel. So I've really spent my career, I hate to say trying to change healthcare because that has a very negative connotation to make healthcare seem like it's broken. But I think it could definitely be better and could definitely provide a better patient experience and really allow providers to provide more, right? And the more patients you see, obviously, the more revenue you get. And there's just a lot of waste in that equation of connecting providers with patients. And automation is a great way to kind of automate all the behind the scenes stuff that the patients don't really care about, the providers don't really enjoy. So let's automate all of that and make this as seamless as possible and bring two people together, both patient and provider, and really have meaningful discussions about their health and their care without all the administrative nonsense that we've got in place in healthcare.
Yeah, that's a fantastic introduction. And coming from the healthcare, I really see what you're talking about and being a consultant. So we'll get started. So exactly when you're a business consultant and you specialize in digital transformation, but tell the listeners more about what it is and how it fits into your business.
Absolutely. People will tell you that I hate buzzwords like digital transformation. It sounds amazing. It sounds like we should all be doing it. And then you say, what is digital transformation? And everyone goes, I don't know. It's really leveraging technology, whether that be software or hardware, and really taking that and doing something meaningful with it, right? To impact the business, whether that's freeing people up from living in spreadsheets and doing data entry and letting them be more present and more patient facing. Or it could be, really looking at larger problems like how do we better schedule an OR, so that we don't have doctors booking 4 hours for a procedure when really they never used it more than 2 hours. And every time they book 4 hours, we waste 2 hours, right? Yeah. Or how do we bring tumor boards digital, right? How do we have people collaborating on better patient care in a virtual environment and leverage all the technology that's at place to give a great experience to our providers so they can give better patient care to their patients? And recently, until very recently, until the pandemic, healthcare was kind of in this slow moving, method of digital transformation. Then the pandemic hit and it was like, oh, shoot, we need to do this now. And all of a sudden, suddenly digital transformation happened almost overnight, right? All the providers were able to see their patients remotely using telemedicine. Suddenly we just at a click of a button, we were suddenly digitally transformed in healthcare. And now that we're, stabilizing a little bit on the pandemic, although, I don't think we're out, but we're starting to regress, right? It's kind of interesting. Like people are like, oh, all this technology is too much. I've got to go back to the normal ways that we provided care. So it's interesting, but that's my passion. My passion is to really understand the business problem. What does the provider want to do? What does the organization want to do? What problem are we trying to solve? And then, let me dig into my bag of tricks of technology and bring things like RPA or process automation, or sometimes you just have a terrible process, or maybe you have bad people and you just need somebody to come in and go, hey, sorry to say, but like this person, they're a little overhead and they just aren't cutting it, right? It's easier for a consultant to do than somebody who's in the day-to-day.
Yeah. You mentioned something called robotic process automation, RPA. Briefly, just describe what it is and why it's a game changer.
Love it. So RPA, the other misnomer I think around technology is that it's really expensive and nobody can afford it. Robotic process automation, the software for it is relatively consumable and affordable for a license. And it's like, I call it digital labor. So it's like adding an actual person to your workforce that can go around and do tasks that your staff doesn't want to do. It can do things like open and read emails, right, through OCR scanning. It can send emails, it can process files, it can go get files, it can do computational analysis. It really can do anything that you do on a computer. It can log into Epic or Cerner or Allscripts or any of the systems that you use. It can wait, right? Like if you're like, oh, I've got to send Dr. Lou a file, and when I get it back, then I need to go do this, right? You're like, the robotic process automation can't do that. What if it takes them 3 days or 5 days or 10 days? It actually can. It's a form of artificial intelligence. I hate using that term also because it's not really intelligent, and it doesn't have feelings, although it can do sentiment analysis. If Dr. Lou types me an email in all caps using several expletives and I can sentiment analysis that Dr. Lou's pretty upset with me, I better pay attention to that email, right, and route it differently. It can do all of that. So it's really advanced, started about 15 years ago in Europe, in the financial industry. All the big banks in the US use a lot of it. Healthcare is a little laggard, right? We're probably on just getting started on that journey, along with like retail and such, where other industries have been further along. So it's relatively inexpensive. It's relatively quick to deploy. A few months, less than $25,000 for a license, depending on the technology. And you literally can automate an FTE's worth of work, or 2 or 3 with just one robot license. So it becomes a bit of a game changer. And I used to say that RPA and that type of technology used to be a competitive advantage. And that's no longer the case, right? It's now really a competitive necessity because all the other players are doing it. Your competitors are doing it. So if you're not at least paying attention to it and seeing how you can integrate it into your process, you're going to be outpaced, right? And these other folks are going to be able to do things faster and cheaper. They're going to have higher client satisfaction, and lower costs, right? And we all know in business that's a losing situation if you're on the other end of that.
Yeah, it's quite interesting. There was one, I was reading one book by Peter Diamandis talking about just software as a service and AI as a service, and talking about companies moving into the fourth industrial age. And he was saying that it'll be a necessity that, such as you mentioned, companies that don't implement these SaaS or AI AAS will be out of, you either survive or you'll be out of business. So it's quite interesting. You talk about a lot about technology and digital transformation, but in your work you really focus on other things, and you describe something as the focus should not be on technology. What do you mean by that, and expand on that?
That's a great question. So people get, the software vendors are not your friends. Meaning if you're following along at home and you open a Google browser and you type in RPA, you're going to be overwhelmed by everybody claiming they've got the panacea for whatever your problem is, right? If you need to solve a business process, they can fix it. If you need to solve, a technology issue, they can fix it. And people get like sold, right? They get sold by these software vendors, obviously, that their platform can fix everything. What they wind up doing, right, and I've seen it so many times in healthcare, is they believe, and they buy a bunch of licenses, they buy technology, and then when it comes time to having that technology solution their business problem, well, it tends to fall short, right? So I always say, let's focus first on the business problem, right? Let's really look at what is the problem and what do we want the answer to be, right? You tell me the perfect state of how you want your business to be, or how it to operate, or the experience for your patient. And then let me kind of solution that, right? And we usually start with, how are you doing at current state? We look for problems in the business process. That has nothing to do with technology, right? You just might have an old or outdated process that just needs to be updated. That's free, by the way, right? Like, it's free for you to look at your own processes and fix those. You don't need me or a technology to do that. So fix your process first. And then really look at what is the automation opportunity, right? Is it things like, could it be chatbots? Could it be RPA? Could it be you just need some automation technology like a Power Automate that, oh, by the way, you might already own? Right? But don't get hung up on all the different tools, right? Because when you look at a business process that tends to be really long, think of a patient that wants to go see a physician, right? There's all kinds of steps that happen in getting that patient in front of that physician. So when you think about that, then you have to look at it and go, okay, well, we could automate this because maybe they want to not call the doctor's office. Maybe they want to talk to a chatbot, or maybe they want to be able to schedule online, right? Those are two different technologies. One vendor isn't going to solve both of those problems generally. And then maybe we need to automate getting the patient files so that the physician's prepared to see the patient, right? That could be an automation technology like a Power Automate or an RPA. So don't get hung up on the how or what technology to bring to bear, because chances are you need a quiver full of a variety of different arrows to solve the business problem. Focus on what is my business problem, and then go find a solution provider that's really vested in your interests, not trying to sell you software and products. Don't buy the technology until you really figure out what it is you're trying to solve for.
We hope you don't mind this brief interruption from one of our affiliates. Today's affiliate is studentloanadvice.com. Studentloanadvice.com is a company powered by the white coat investor that specializes in helping professional students such as doctors, dentists, and other healthcare professionals navigate the complex and oftentimes confusing student loan landscape. They offer a consultation as well as services to help you save money when consolidating and paying back your student loans through their different options. You can go to their website, studentloanadvice.com/FFFP. That's again, studentloanadvice.com/FFFP to find out more, get signed up on their email list, or schedule a call with Andrew Paulson. Now back to our show. I like that. Yeah, really the problem and then find the solution to that. And it may not be technology, it could be people, it could be software, anything. So that's very insightful. Now, in today's healthcare, I know doctors say, or almost everybody says, the system is broken. It's very bureaucratic and cumbersome and very slow, inefficient, very expensive. So what are some, like healthcare, if I'm a healthcare CEO and I want to bring my organization into the 21st century, what are some game-changing technologies organizations should be looking at?
Yeah, we just went through, I'd say the last decade, we probably spent a decade working on what we thought was a transformational technology, which was EHRs, right? We're going to modernize healthcare and we're going to get an EHR. All you did is take a bunch of paper and make it really difficult to discern and get to and access and such. And then you put it in this massive system like Epic. People are so excited about Epic, unless you're a user of Epic. And then you're like, oh, okay, it's all right. But it still really doesn't transform healthcare, right? And we spent billions and trillions of dollars doing all this EHR journey. And I don't care if you're a small physician practice, right? You have an EHR, or if you're a provider in a really large space, or you're a patient and you go to the doctor, right? You're interacting in some way with these large monolith EHR systems that honestly aren't transformational. They didn't transform anything, right? The patient experience is relatively still the same. So really, when I look at it, I really look at trying to transform healthcare again in that person-to-person context, right? So I've deployed systems where the physician doesn't stand behind, we used to call them cows, right? Or wows, workstations on wheels, these big barriers to the physician being anywhere near the patient, right? Gone are the days where the physician actually reaches out, and touches the patient because, we've got all this craziness there. But, getting like the EHR on tablets, so that the physician can sit next to the patient and like show the patient like, oh, here's your x-rays here. And you're sitting next to the patient, not projecting on some wall, right? We've done things with registration, right? Where you walk in and there's this huge line of people waiting to talk to a receptionist to give them their insurance information. Are you kidding me? Like, what century are we in, right? So we've done a, I'm probably under NDA and I'm probably going to break it, but it's so cool. I'm just going to talk about it anyway. We've partnered with a system that you might see in the airport. They wear checkered shirts and they do biometric identification. And what we did is we said, hey, can't we keep like their insurance card information and a payment card on file? And then we could just have a couple terminals and they could walk up. We could biometrically identify that Michael Grace is here for his appointment. Okay, we could use automation and we could verify that his insurance is valid. We could understand what his copay is. We could tell him, like, would you like to pay your $35 copay? Yes, I would. Click. Okay, they've now paid their copay, right? All in a matter of seconds. Oh, and then we can send a text to the provider and let the provider know, hey, Michael Grace is in the waiting room. And oh, while we were biometrically identifying him, we've taken a picture of his face. Here's what he looks like. So when you open the door, you don't go, Michael Grace, it's Michael Grace out here, right? You can simply walk over to the person and say, oh, hi, I'm Dr. Lou. Would you like to come back now? Totally a transformational experience, right? Think about that kind of experience from a patient perspective versus the insanity that we do today, right? So we can change healthcare in a lot of ways that are meaningful to the patient, leveraging technology for not a lot of cost. I think we're just resistant to that kind of change. We're a little too pre-bought into the EHR is going to save the world. And I think, we're all starting to realize that the EHR isn't probably coming to our rescue anytime soon. If anything, it makes our life a little bit more complicated. So there's changes coming. I think there's a lot of small startups. If you really look at healthcare and look at the startup space, a lot of companies in that startup space with really great ideas on ways to transform that patient experience and provide better healthcare.
Yeah. There's so many opportunities for game-changing innovation, technology, software, systems, processes. Yeah, there's actually a joke among the whole healthcare community that the Epic, the Cerner system, was just turned everybody into clicking buttons, and it was wait for the insurance companies to bill more and charge more. So it was really for just so the hospitals could bill more and charge more and increase revenue. It wasn't really to change anything. So
it's crazy, right? I had to go for I was serving a local hospital here in Arizona, down in southern Arizona, and they required a TB test, and I couldn't find my copy, so I had to go to CVS. I had to go get a TB test. Right? They gave me the shot. And then I was sitting there and I was like, can I go? And she's like, oh, she's just diligently like on her keyboard. And I'm like, what do you like? It took 10 seconds for the shot, but it took her 10 minutes to do all the documentation that she gave me a shot. Right. Yeah. And then when I came back for the reading, the same thing, walked in, sat down, and she looks at my arm. She goes, you're negative. I said, okay. And then she goes, and I'm like, what are you doing? And 10 minutes again, where she's like, I've got to document that you're negative. I'm like, this is insane, right? And it's all the EHR. So the EHR has created a real barrier. My wife is a ICU nurse, now a lung transplant coordinator, and I just watch all the stuff that she has to do, right? And it's crazy. Like, oh, I've got to document in the donor network. I got to document in the EHR. I got to document here, document there, blah, blah, blah. And then she creates a shadow chart so her and her physician can talk to the physician. And it's a paper chart. And I'm like, are you kidding me? You're using Epic and Cerner. Like, what are you doing? And you have a paper chart that's the most important thing in her life. She carries them around, right? That tells me that the EHR has failed, right? If we're printing stuff out to create shadow charts and stuff, yeah, funny joke. Epic failure on the part of the EHR.
Yeah, we could share so many stories. But
yeah. I mean, patients should really demand better, right?
Yeah.
Like they should really hold their providers accountable to use better technology for their care, right? And I think the silent player in this space is Apple.
Definitely.
Apple's been kind of absent by purpose, right? Apple waits for the right moment to do disruption, and I think it's coming from everything that I'm hearing. They've silently been, getting their watch really honed in, so now a watch can do an EKG. They've got fall detection and EMS notification into their watches and their wearables. And Apple's slowly coming around the corner, I think, very silently to not draw attention. But I think Apple's going to enter the healthcare space here in a big way pretty soon. And you know what? Like the rest of their products, it's just going to work.
Yeah. It's, if I think if people on the if healthcare organizations hire designers and engineers with the same mentality that you see at like Apple or Google or any of these the big tech companies, I think are where we could progress so much faster. And now we're on that subject. It's quite interesting. What you see? How do you see that healthcare can improve by leveraging technology?
Well, and I love what you said about designers, right? Because anytime I go into a customer or client, whether it be large healthcare system or providers, they always want to tell me what they're doing today. And I always go, this is awesome. And they bring in boxes of stuff and they want to show me. And I'm like, I wouldn't be here if it was going great, right? You wouldn't have called me. So I appreciate you gathering all this stuff, but I don't want to talk about that, right? I want to do what designers do. I want to talk about, what do you want your patient experience to be like?
Yeah.
Right? How do you want that to go, right? And then I try to tell heartfelt stories that give people goosebumps, right? I look for goosebumps moments because healthcare should be that way, right? Where people don't seek out healthcare other than physicals and routine care. They generally don't seek out healthcare when they're perfectly healthy, right? Something's wrong. They don't feel good. They're having some sort of an issue, right? We need to care. We need to get out from behind technology and get a person with a person providing great care and figure out a way to get the technology to catch up to that moment behind the scenes, not be a barrier in between the two people to do it. We've explored with companies called Nuance that does a software that we use in the medical world called Dragon Medical One. It's a great dictation software. It's kind of like Siri for physicians. It just happens to understand all the large complex words that we use in medicine to make ourselves sound impressive. And we've done things like room monitoring, right? We monitor everything that happens in the room, and we've proven that if we monitor the entire room, we can fill out the charts, we can appropriately bill the codes for insurance, we can capture the procedures that happen, we can capture all the stuff that was used. And why isn't that technology being used? Because of the liability to the physicians if something happens that's wrong, right? Unfortunately, right, we're in a sue crazy world, and the physician was trying to do the right thing, and you know what? Sorry, Dr. Lou, but you're human, right? And occasionally you might make a mistake. It's not intentional, but because of that, right, we were like, oh, we can't capture all this because there's no way to get out of this, even though it could totally eliminate well, not totally, but it could 75-80% eliminate the need for charting, eliminate the need for billing, right? It could all just happen, but the fear of that and HIPAA, and there was a couple of other reasons why it couldn't happen, right? But we're poised on the edge, I think, for technology to be a game changer in healthcare. We need to get back to being humans and trust each other and realize that physicians have the intent of trying to help, but they're human. Your care providers, they're human. There's all kinds of stories, right? We just were experiencing on the news the story of the nurse who pushed the wrong drug, right? Yeah. That wasn't her intent. And the EMR was down, right? There was no drug warning or such because the EMR was down, but yet she was prosecuted, right? And the intent, I think, was, we got to get back to the spirit of intent of what we're trying to do in healthcare, and then let technology come alongside the provider space and help them.
Yeah. It's been a fantastic conversation, and we may have future. You have a lot of experience and knowledge in healthcare IT and consulting, and it'll be very fascinating for future topics. So, what is I know some people will want to reach out to you, get a hold of you, work with you. How can people do that?
Sure. So I, like Dr. Liu, I'm a podcaster and blogger and content creator, partially around healthcare, but much like yourself, right? It's just about putting knowledge out there that hopefully helps people. So the best way to probably find me personally is on my podcast, which is out at techprounicorn.com. And then my company is rpic.com or RPI Consultants.com, but it's at rpic.com. And either of those two ways, you'll be able to get a hold of me.
So for all the listeners, all the resources will be included in the show notes. So it's been a fantastic conversation, and we'll look forward to having you as a guest in the future.
Awesome. Thank you.
What a fantastic show. I hope you enjoyed our very special guest. Just remember, as a shout out to our this week's sponsor, cityvest.com. Cityvest gives you access to the best real estate private equity funds with enhanced investment terms, verified due diligence, and lower risk. You can check them out at cityvest.com or click on the link in the show notes below to hear about their upcoming investment offerings. If you enjoyed that episode, don't forget, that's just the free content. We also have paid premium content subscription with better guests, information, updates, and discussions that can't be accessed anywhere else. You can subscribe to our premium content by clicking on the link in the show notes below to subscribe. Just a quick note, members who sign up for the bottom floor price introductory the first year will be grandfathered into that price for life. I expect the monthly subscription amount to increase quickly next year and the year after, so don't delay. I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislumdphd.com for more support. I'll see you next week.